we were like, what? This is like exactly Life Esidimeni.
Christine Ngumalo is one of the family members who lost a loved one in the Life Esidimeni tragedy. Her sister, Virginia Makpela, starved after being transferred from Life Esidimeni to an unlicensed NGO. Makpela was diagnosed at the Charlotte Maxeke Hospital before being admitted to the Life Esidimeni. Ngumalo says the delay in the reopening of the facility's fire-damaged mental health section could have dire consequences.
There's nothing that has happened to improve mental health in any part of Gauteng. So you can imagine our shock. So there's no surprise that with Charlotte Maxeke shutting down, that everything and everybody else, because generally what happens is Charlotte Maxeke will diagnose and will basically send to the relevant places, because that's what happened with my sister. That's how she ended up in Life Esidimeni in Randfontein. She went to Charlotte Maxeke, spent some time there, did test, diagnosed her because no one else could diagnose her, and that's how she was sent to Life Esidimeni in Randfontein. So you can see the importance of Charlotte Maxeke, and for them to downplay it the way they're downplaying it now is shocking.
The health minister says the delay in the reopening of the affected sections is due to the theft of copper and equipment.
So Helen Joseph has had to carry quite a lot, and because of the one of those areas is the mental health area. Helen Joseph has had to carry a lot in terms of that, but also there's been an increase in demand for mental health services. So this has put a lot of pressure on Helen Joseph Hospital. And because of the fact that here at Charlotte Maxeke Johannesburg Academic Hospital, the mental health areas, the facilities which were catering for acute mental health have not been active. So Charlotte Maxeke has had to carry that. So increasingly, as the casualty and emergency unit get opened, some activity, there will be capacity to take care of some of the acute mental health patients. So this will relieve some of the pressure.
The South African Society of Psychiatrists is also sounding the alarm.
They are not coping. You may take it. I mean, Charlotte Maxeke has lost 40 beds with a fire, and one may think that it's 40 beds, only 40 beds. It's a small number. But how these hospitals, acute hospitals work? They work on a very high turnover of patients. So they admit patients, treat them fast, and discharge them so that they open space for others. So those 40 beds at Charlotte Maxeke are a big contribution. So because of that, then there's, as I say, there's overcrowding at Helen Joseph, and that will result in a poor care for the patients. The patients are not being treated by the team that is trained to treat these patients. Remember, Crystal, that these patients are not the easy patients. The reason that they're at Helen Joseph or Charlotte Maxeke, it means they need specialist care. So that specialist care can't be offered at casualty department of a hospital. It has to be offered in a psychiatric ward.
Well, it's hoped that some of the pressure will be alleviated when Charlotte Maxeke's emergency unit is expected to reopen at the end of April. Griselda Lewis, SABC News in Johannesburg.